Hi, I'm Shannon, and today I'm going to talk about aptamers as a novel approach to drug delivery for pancreatic tumors. Just to give you a little bit of background on pancreatic cancer, in 2015 there were 49,000 new cases diagnosed in the U.S. alone. If you look at all cancers, however, this pancreatic cancer actually only accounts for about 3% of all cancers. So it's not actually a very large piece of the pie as far as cancer goes. However, if you look at the leading causes of cancer death, pancreatic cancer ranks fourth only behind lung, colon, and breast cancer. And it also has a very low 5-year survival rate of only about 5%, making it the worst survival rate of any cancer. And this is largely due to late diagnosis, since most pancreatic cancers aren't usually diagnosed until they've fully metastasized to other organs. The current standards of care for pancreatic cancer are to use surgical resection. However, this only works for localized tumors, so only about 15% of patients even qualify for this. And for the other 85% of patients, the most common standard of care is chemotherapy using the drug gemcitabine. Gemcitabine is a nucleoside analog that is taken up into the cell and through a series of phosphorylations becomes activated into its diphosphate and triphosphate forms, which then can exert a cytotoxic effect on the cell. More importantly, the triphosphate form can actually be directly incorporated into DNA, which is what halts DNA synthesis and is what creates the cytotoxic effect. The downsides to using this drug, however, is that it's rapidly cleared, meaning that it tends to require a very high dose. However, the amount that you can actually give someone is also limited by the fact that gemcitabine is non-specific, meaning that it's still toxic to other normal cells, so you are limited by how much you can actually give someone. So some alternative approaches to better treating pancreatic cancer have involved antibody-mediated targeted therapy, which can more specifically target cancer cells, or to use liposome or nanoparticle carriers, which can also preferentially target tumors using the EPR effect. In normal vasculature, your endothelial cells are well lined and prevent large molecules from penetrating through. However, in tumors, your vasculature tends to be more leaky, which results in so larger macromolecules can then accumulate in tumors. So in the case of liposome and nanoparticle carriers, they can accumulate at the tumor and then slowly release their drug out into the tumor cells. This has been an incredibly effective strategy for treating a lot of other cancers. However, for pancreatic cancer, this hasn't really seen the same levels of effectiveness. And one guess for why this may be the case is due to desmoplasia, which is this increase in stroma and extracellular matrix that you see in pancreatic cancers. Pancreatic tumors tend to be very, very dense with this extracellular matrix that, as you can see here in blue, and this tends to cause constriction of your vasculature, which can lead to poor drug delivery. One alternative, and another alternative approach that people have started looking at a lot more is aptamers. Aptamers are a lot like antibodies, but they are made out of short oligonucleotides. But like antibodies, they can form three-dimensional structures and specifically bind targets. They have many advantages over antibodies. Because they're smaller, they have little to no immunogenicity, and they can also better penetrate tumors and have better bioavailability. They can reach more small spaces. They also have been shown to have a longer shelf life, and they're also chemically produced, meaning they're much more easy to manufacture. And to further this, some studies have been done where people have actually tried to incorporate the gemcitabine drug directly into aptamers, since aptamers are oligonucleotides and gemcitabine is a nucleoside analog. If you can see here, it's very similar in structure to cytosine, and so it can actually be used to replace cytosine in sequences. So Ray has shown that you can actually incorporate it into a polymer an RNA polymer specifically. And similarly, BIOE612 has actually made an aptamer that directly incorporates gencitabine directly into the structure.